Hi, Dr. Still. I saw those two patients that you wanted me to see before, but the third patient that I saw, he's having a little bit of difficulty. He came in today with some rectal bleeding. Not really sure what's going on with that. He said he had it for a couple of days. His presenting symptom was he had some blood in his underpants today. Doesn't seem to be much else going on with him. He did say it was a smoker. The physical exam was pretty much benign, but seems to be doing okay.
Okay, how old is this guy?
I'm 69.
Okay, and this is the first time he's had blood in his rectum?
Yeah, as far as I know.
Is he scared?
He seems kind of scared.
And what do you think's going on?
Not really sure. You know, I was a little worried when he said he had that bleeding like that. I don't know really what much else it could be. I mean, the worst thing it could be is something like some cancers or something.
That's good thinking.
Yeah,
Mm-hmm.
but
So
then it could be just like a hemorrhoid or something.
So how scared are you of finding an answer? Do you need to find an answer right now? Is it something that can't wait?
He doesn't seem to be acutely ill now. He seems mainly more worried and stuff with it. I did have those two other patients, so I thought he could sit for a little bit. But it didn't seem like he was really doing too bad.
Do you have vital signs?
He did have vital signs. His blood pressure was normal. His pulse was normal. You know, we haven't gotten any labs yet on him.
And do you have orthostatics sitting down?
Didn't do orthostatics. No. He did have 2-second capillary refill, so that was good.
Because if they're orthostatic positive, then I'm a little bit concerned and we get the patient to the emergency room for further workup. And you said 2-second capillary refill.
Right.
Beautiful. So he hasn't lost too much blood, but you don't know how much blood he's lost.
Right.
Did you do a rectal?
Didn't. Yeah, that'd be a good thing. I should have done a rectal. You're right.
So what are you worried about right now?
I'm not so much worried about him, although now that I think about it, with your suggestions, I'm thinking that maybe I need to go back and do the rectal exam, maybe get a little bit better idea of his vitals with orthostatics. Because if he is orthostatic and he is more acute, then that changes the differential.
So you got some good information, and it sounds like this patient is sick and does need further evaluation. What's the first thing you want to know?
With him?
Mm-hmm.
Sort of how sick he is.
Yeah, is the bleeding still going on, or is this something that's...
Yeah, I don't know that because, again, I didn't do the rectal exam, but he did say he had some of that bright red blood in his underpants today.
Mm-hmm.
Yeah, and he seems really worried. I mean, that was something that I noticed with him, is he seemed to be worried. His family was in with him, his daughter and his wife was in with him as well, are in with him, and they seem kind of worried about this.
And it's hard to leave the other two patients behind and just focus on this one patient, but it sounds like we really need to focus on this guy and figure out how bad it is and what we need to do.
Okay.
Do you think we could take care of him here?
Maybe after I get the orthostatics and such. My gut feeling now says we could probably take care of him here, but we'll get some more data.
Okay. Would you feel comfortable not having a CBC, not knowing what his level is, or do you feel we need that too?
We probably need some labs with him.
And if he's orthostatic negative, I think we can get it here and wait for the answer, but sometimes you do need the answer. It depends on how he looks.
Yeah.
Let's go see the patient.
All right, thanks.